This video is intended to show you the general flow of an assessment for a standard ICU patient who is intubated with an arterial line and multiple medications. In the clinical setting, your assessments will need to be based on your patient's presenting problem and current condition.
Hi, David. My name's Joan. I'm going to be your nurse today.
Introduce yourself to the patient and, if present, the family, and explain what you're going to do. This should be done regardless of the patient's level of consciousness. As with any initial interaction with your patient, ensure you are following correct infection prevention and control policies with hand hygiene and appropriate personal protection equipment. Even during this potentially short interaction, you will begin to collect important information about your patient. Is he or she awake and alert? Does your patient focus on you when you introduce yourself? Does the family appear stressed?
So I'm going to get you to give my fingers a squeeze. Squeeze hard as you can.
The basic neurological assessment consists of 4 components: level of consciousness, pupils, vital signs including pain, and motor strength. These will be demonstrated for both a responsive and non-responsive patient in this video. It is important to remember that the goal with the neurological assessment is to get the best possible response. This means that whenever possible, you should remove or reduce sedation prior to assessment. Relying solely on blood pressure or cardiac output to determine adequate circulation can lead to erroneous conclusions. Techniques to assess peripheral perfusion include palpation, as with pedal pulses, capillary refill, and edema, and inspection, where we look for mottling, evidence of bleeding, and cyanosis.
In here, I'm just going to check your pupils. Okay, so I want you to look right at me. Great. Okay. Your IV here. Can you turn your head a little bit that way? Perfect. Okay, I'm just going to be listening to your chest here. Just need to expose you a little bit.
The most common techniques used for pulmonary physical assessment are inspection and auscultation. For inspection, observe the general appearance and state of the patient, including color, such as cyanosis, mottling, pallor, rate, rhythm, and pattern of breathing, symmetry of chest expansion, and the shape of the chest. During auscultation, proceed in a systematic manner, comparing one side of the chest with the other. Develop a pattern that assures complete coverage, such as from the apices of the lungs to the bases. Your assessment will, of course, depend upon the individual person. For example, if your patient is unable to sit up or requires assistance with moving, you may need to leave auscultation of the posterior lobes until others are available to assist you in turning your patient.
To your belly.
Your abdominal assessment will include inspection, auscultation, and palpation. While inspecting the abdomen, look for asymmetry, distension, abnormal coloring, and scars. Auscultation should be used to assess bowel sounds in all 4 quadrants, and palpation to identify areas of tenderness and whether the abdomen is hard or soft. If the patient has a feeding tube, assess patency and record length of insertion. If the patient is receiving enteral nutrition, assess tolerance and adequacy. Finally, assess any abdominal wounds and drains. Many patients in the ICU require intubation and mechanical ventilation due to their inability to maintain airway, oxygenation or ventilation issues, or both. Therefore, part of your assessment will be to assess the patient's airway and review the ventilator settings. Most ICU patients will have a Foley catheter to ensure accurate measurement of output. When assessing the catheter and urine, ensure you document the color and amount of urine and assess the urethra for irritation, discharge, or damage. It is also important to assess the perineal area for signs of redness, infection, and skin breakdown.
Hi, David. Just going to do a quick assessment here, David. My name's Joan. I'm going to be your nurse today. David, can you open your eyes? David, open your eyes. Come on, David, open your eyes. Can you squeeze my fingers? Come on, squeeze my fingers. Can you move your toes? Let me see you wiggle your toes. Okay, David, I'm going to have to do a little bit of pain here. I just want to get a response from you. Okay, all right, good, awesome. Sorry about that, buddy. Okay, let me check your pupils.